Appreciate that. So once again, my name is Yolande Burris. I am with Amplify, the African American Statewide Coordinating Center, and my pronouns are she, her, hers. And today we're going to be discussing celebration, of course, Black History Month. We'll be talking about African Americans, and we will also be talking about heart health. We're going to round it out with discussing policy wins in the city of Berkeley. So Tino is going to cover the second half of our webinar and go into detail of local statistics and wins. So for those who don't know, Amplify provides culturally relevant expert support and tailored assistance to tobacco control programs, non-traditional partners, and the greater community. We work collectively to engage African Americans and the immigrant communities that are in California. We were established in 2018 through the California Tobacco Control Program and were funded through Proposition 56, the Cigarette Tax Initiative. We provide technical support to community-based organizations throughout the state, and we work within our communities to eliminate the burden of tobacco. And we truly love Black smokers. We never vilify them, but we want them to live a life that's free from addiction of nicotine. And of course, we educate them to understand that they've been targeted by an industry that's only out for profit and has left nothing but death and destruction behind in our communities. So, in celebration of wonderful, amazing, talented African Americans, I couldn't let this moment go by without recognizing Jamie Foxx. And we're so glad that he's still around to bring blessings and joy in our world through TV, through comedy. He has a Netflix special currently out, and it's called What Had Happened Was. And I'm going to play a bit of this for you because he gave audiences a glimpse into his near fatal medical emergency. And this moment really reshaped his life. And it's a story of survival and it's moving and powerful. And it's also a reminder of the fragility of our lives and how important it is to prioritize our health.
What had happened was on stage, on the record, and in tears. Man, please, Lord, let me get through this. An emotional Jamie is finally explaining exactly what happened and the frightening news that doctors told his family. He's having this brain bleed that led to a stroke, and if I don't go in his head right now, we're gonna lose him. Jamie collapsed in Atlanta while filming his movie with Cameron Diaz back in action. It's like old times, baby. And with his signature humor, he revealed what his sister told the doctor after they got that life and death news. You can go in his head, but you ain't gonna find nothing. My sister made a joke because sometimes you gotta laugh to keep from crying. But in the Netflix special that just earned him a Golden Globe nomination, Jamie revealed the emergency was sparked by a bad headache. Before I could get the aspirin, they don't, I don't remember 20 days. What I was told is that they take me in to operate on me, and my sister knelt down outside the operating room and prayed the whole time. They said at one point, the first 15 days, they thought they were going to lose me because my vitals were out of control. That's when a miracle happened. And that miracle was working through my youngest daughter. She snuck into my hospital room with her guitar. And she says, I know what my daddy needs. His oldest daughter. What had happened?
So I'm just grateful for Jimmy Fox for sharing his public health scare with all of us and for his recovery and just his courageous story. I hope that you found it courageous. And when you get a moment to please check out his Netflix special. Now, Jamie's also been known to smoke a cigar or two through the years. I've seen pictures and videos of him smoking cigars and also consuming alcohol. Jamie Foxx's testimony is exactly what Amplify is all about. Our mission is to work collectively in love, unity, and cultural humility to educate, empower, and engage our communities to end commercial tobacco use. The moments that premature death creates, so many of us could possibly be prevented. So many times this could be prevented. And his story is a powerful reminder that life is precious and it's fragile, and it highlights the importance of prioritizing our health. Oftentimes we ignore signs: high blood pressure, diabetes, our kidney health, our weight, nutrition, and stress, and then it's just too late. So by neglecting critical aspects of our health, we're not only risking our lives, but we're setting ourselves up to miss moments that matter to us most. And that's our futures, our kids walking down the aisle, going to graduations, holding our grandchildren, our future grandchildren, and celebrating milestones with loved ones. So this year, let's have a call to action to prioritize health, and particularly when it comes to tobacco use. Black America's been through a lot of turmoil in the last couple of years. We've had the Black Lives Matter movement emerge stronger than ever. Human rights were being violated, filmed and televised with the murder of George Floyd. COVID, a contentious presidential election. We got drones flying in the air. We're living in unprecedented and uncertain times, and racism and hatred is on the rise in our communities and in our schools. Systemic racism, police brutality, food insecurity, prison reform, LGBTQ rights, Black transgender violence, and the federal elimination of DEI. The amount of stress that we're under, young and old, causes many of us to seek outlets, and oftentimes it's been smoking that's been used as a stress reliever. So it's important that we learn to view tobacco as a social justice issue that kills 45,000 African Americans every single year. Our communities have been racially targeted for decades, and it's time that we change these outcomes. So in the African American community, we have challenges that just simply hit different. Our smoking prevalence rates in African Americans in California still remains around 16%, and 14% of those users smoke cigarettes. So this is why Amplify does what we do. We do what we do. I like to say this is why we do what we do. And tobacco is killing more African Americans and Blacks every single year. It kills more than homicides and AIDS. It's taken away my grandfather. I'm sure it's taken away your family members, aunts and uncles and parents in our communities too soon. And we want to stop this legacy. Heart health is a significant issue in the Black community. And according to the American Heart Association, Black adults represent more than 50% of heart failure hospitalizations among US adults under age 50. And in the African American community, cardiovascular disease is the leading cause of death. Between 2017 and 2020, almost 59% of Black males and Black women greater than the age of 20 have some form of cardiovascular disease, including coronary disease, stroke, and hypertension. And from the data that we have available to us in 2022, almost 65,000 Black men and 59,000 Black women died from cardiovascular disease. The incidence of hypertension in the entire population in total is about 47%. But in the African American community, 57% of men have hypertension and 58% of women have hypertension, which is a leading risk factor and cause of heart disease and stroke. Let's dive a little deeper. And I reiterate to you that heart health is a significant issue in the Black community. It's a silent killer. African Americans are more likely to die from smoking related diseases, including heart disease and diabetes, more so than Hispanic people and non Hispanic white people. Smoking is a major cause of heart disease, cancer, and stroke, which are the three leading causes of death for African Americans in the United States. And although African Americans typically begin smoking at an older age and smoke fewer cigarettes per day, they're more likely to die from smoking related diseases like heart disease and diabetes. African Americans have the highest mortality rates from tobacco related coronary heart disease and stroke. Let's discuss more links of hypertension and structural racism. So, what do they have in common? Researchers say that these are the two biggest factors that are responsible for the gap in poor heart health and brain health between Black and white adults in the United States. They're inexplicably linked. So, studies have shown that high blood pressure, also called hypertension, affects Black adults, particularly women, earlier and more dramatically than their white peers. And by age 55, research has shown that 3 of 4 Black adults have already developed the condition compared to about half of white men and 40% of white women. Untreated high blood pressure can lead to a range of debilitating and potentially fatal chronic illnesses. And of course, this includes heart disease, stroke, dementia, kidney disease, sexual dysfunction, and loss of vision. So, behind these elevated risks are a very complex and negative influence stemming from multi generational impacts of structural racism. And Chandra Jackson is a researcher and investigator with the National Institute of Environmental Health Sciences. She considers structural racism as the totality of ways in which societies foster racial discrimination through mutually reinforcing systems of housing, education, employment, wages, benefits, credit, media, healthcare, and criminal justice. An example would be decades of discriminatory lending known as redlining. It's kept Black families segregated in neighborhoods and urban neighborhoods, particularly with fewer resources, greater chronic exposure to environmental hazards like unclean drinking water, noise, and air pollution. And these types of neighborhoods also tend to lack quality healthcare facilities and providers, grocery stores that sell healthy and affordable foods, or open spaces where adults can exercise and children can play freely and feel safe. Discriminatory employment and educational systems result in higher levels of poverty, and this creates financial strain on the household, limited housing and food insecurity, strained relationships, and less access to good health insurance. So these factors, which are several, along with the indignities of racial discrimination and injustice, just increases stress overall. And Black men and women report higher levels of stress than their white counterparts. And in turn, this may be associated with the increase of blood pressure. Black women and high blood pressure. Now, studies have shown that Black women who experience the compounding effects of both race and gender discrimination, along with the chronic stress, have to work harder to overcome this dual bias. Black women have a shorter life expectancy than white women, in part due to higher rates of heart disease. The stress also makes it harder to manage heart and brain health risks, and these factors, such as high blood pressure, once they do take hold. The studies have also found that Black women with high blood pressure experience high levels of stress, were substantially less likely to take medication or practice blood pressure lowering behaviors such as exercising or eating a healthy diet. So there's social and environmental factors that present an added barrier to physical activity and diet. Not to mention, our hair as well. That's a factor. And this accounts for a lot of health disparities we see today. So when we do talk to Black women, there's several actually legitimate excuses, and one that I've heard a lot is my hair. And so we need to make sure that we're able to get past our hair and really focus on our health and our wellness. Disparities in healthcare. Overcoming these barriers has definitely been challenging, but there have been successes. And a great example of success is our very own Kaiser Permanente in California. They eliminated differences in control among Black and white adults regarding hypertension. The program used electronic health records to track blood pressure, increase doctor-patient messaging outside of office visits, and lower the price of blood pressure medication to make it more affordable and accessible. And Dr. John Ananian with the University of Michigan led the study, and it showed that disparities in blood pressure among Black and white Medicare Advantage enrollees persisted in every region across the nation, except in the West, where the Kaiser Health Plan was available. So his research also showed that Black adults were disproportionately enrolled in lower performing health plans nationwide. And he stated that we cannot rely on the efforts of individuals or doctors. We need a well-functioning healthcare delivery system. So it is a challenge to ask people to improve their diet when they don't even have access to healthy foods, to exercise, when they don't have access to safe or affordable spaces, or to take blood pressure medications that is just simply not affordable for them or even accessible to obtain. So, in discussing this reality that many African Americans are facing, I want to take a deeper dive for us to really understand just the very basics of why this is happening, why Big Tobacco has chosen to target African Americans. And it's the link between melanin and nicotine. The research of our colleague, Dr. Valerie Yerger and Ruth Malone on melanin and nicotine revealed that tobacco companies funded scientists in the 1950s and 1960s and marketing executives to thoroughly research our DNA, our behaviors, and overall attitudes. They went into our urban neighborhoods, they went into our bars, our clubs, even employment. They went into our places of worship. They went into our organizations such as NAACP, and they learned our behaviors and they observed our behaviors. And through the release of the tobacco industry documents in the 90s, they learned that scientists had discovered that nicotine has a biochemical affinity for melanin. Nicotine remains in melanated skin longer than non-melanated skin. And even though African Americans smoke fewer cigarettes than some other groups, they still have a higher intake of nicotine from each cigarette. And subsequently, menthol allows for deeper inhalation. Let's look at smoking's physical effects on the body. And I've categorized this under lifestyle because your life is truly in your hands. And despite all of these factors I've discussed, the social determinants of health, smoking is a choice, and heart disease could be a consequence of that choice. The smoking is a major risk factor for heart disease. The chemicals in cigarette smoke damage the heart and blood vessels, and it leads to atherosclerosis, which is plaque buildup in the arteries. And even occasionally smoking can cause harm to heart and blood vessels. So please make sure you tell your blunt smokers, tell your cigar smokers that, hey, even though you might do this on occasion, on the weekend, especially Black men hanging out with their boys, Let them know that even occasionally smoking can cause harm heart to their heart and blood vessels and potentially lead to stroke. And as discussed, there is increased risk for certain groups, such as melanated people, but smoking also poses a greater risk for women who use birth control pills and people with diabetes. And if combined with other risk factors that they already have, like high cholesterol, high blood pressure, or obesity, smoking further increases the risk of heart disease. So, unfortunately, there's just no safe level of secondhand smoke. African American children and adults are more likely to be exposed to secondhand smoke than any other racial or ethnic group. African American people don't smoke generally, who don't smoke, still have high levels of cotinine, which is a chemical found in the body. That means a person has been exposed to tobacco smoke. Um, they have a higher content than other people in other races and ethnicities who don't smoke. This is also a big concern with our hookah lounges and bars where we have our African American women serving and African American men serving hookah and inhaling the smoke that is in these facilities. The secondhand smoke comes from exhaled smoke or burning of the end of tobacco products, and it damages the heart and blood vessels just the same as non-smokers. Smoking is a major cause of cardiovascular disease and is responsible for 1 in every 4 deaths. So, estimates show that smoking increases the risk of coronary heart disease by 2 to 4 times, and for stroke by 2 to 4 times as well, compared to not smoking. So, even people who smoke fewer than 5 cigarettes a day have early signs of cardiovascular disease. So I'd like to leave this webinar with you being able to recognize the signs of heart trouble. And one of the most crucial steps in saving lives is recognizing the warning signs of cardiovascular distress. Knowing the symptoms of a stroke with this acronym could save somebody's life, and that's FAST, F-A-S-T, face drooping, arm weakness, speech difficulty, and the T meaning if you're experiencing these symptoms, it's time to call 911. Not to call a friend and let them know you're experiencing these symptoms and you're going to lay down. Please let that friend who calls you know that it's time for them to call 911 and go see the doctor. Good news, of course, is that quitting smoking can help protect people from cardiovascular disease and death. And people who already have the disease can also benefit from quitting smoking. So if you've been smoking for a while, you might wonder if quitting is even worth it. And I say 100% yes. The cravings and nicotine withdrawal may deter people from stopping, but it's only temporary. Your body has this amazing ability to heal itself, and it happens so much quicker than you think. So let's look at what happens to your body when you quit smoking in just 20 minutes. Your pulse and blood pressure drop and go back to normal. Within 12 hours, you're halfway through your first day, and your carbon monoxide level is also back to normal. In 2 days, your sense of taste and smell gets sharper, and your nerve endings miraculously start to heal. That's just 2 days. In 2 weeks to 3 months, you can exercise without getting winded, and your risk of a heart attack goes down even more. And you've also made it through the initial withdrawal period, which is the hardest. In 3 to 9 months, you can take deeper and clearer breaths, and instead of hacking, you don't cough anymore, and your cough is as cough in a helpful way that actually clears things out. So if there is such a thing as a healthy cough, you actually can have a healthy cough in 3 to 9 months. 1 year, your risk of heart disease is now half of what it was a year ago, and that is a huge win. In 5 years, your chances of a stroke and cervical cancer are now the same as a non-smoker. In just 5 years, that's pretty amazing how your body can heal itself. In 10 years, you're now half as likely to die from lung cancer, and the chances that you'll get cancer of the larynx, your voice box, and pancreas, they both drop dramatically. And if you've been a non-smoker for 15 years, the chances that you'll get heart disease are the same as if you never smoked, and your body has done a ton of recovery and healing. And who wouldn't want that? So I'm sure us people who are smokers are thinking, who smoke, are just like, this is great, Elon. Yeah, I would love that to happen. But you just told me about all of these issues regarding comorbidities, discrimination, stress. I'm stressed out. That's why I smoke. What can I do? And I have a question for you. When you recognize the stress, how do you cope with the stress? Well, this is where emotional brain training can come into play, also known as EBT. And it's an evidence-based, brain-based approach to relieving stress overload. So your brain has 5 states that it goes through your entire life. This is how our brain works regarding the feelings and emotion and stress. You have step 1, you're feeling great. You wake up in the morning, you pray, you feel your blessings, and you're just ready to have a great day. You tell yourself, this is going to be a great day. I'm going to make it a great day. The birds are chirping, the sun is out, nothing could go wrong. You go and make yourself breakfast. You're still feeling good. Maybe you leave. You're feeling good. You made breakfast. You made breakfast. You made a really good breakfast for yourself. So maybe you left for work 5 minutes late, but that's no problem because you still have about 10 minutes to get to work on time. Correct? Follow me with my story here. And step 3, you're on your way to work. You're on the freeway, and there's a little traffic, but that's okay because it's stop and go. You still know you're going to make it to work. You might get there and maybe 5 minutes before you start, but hey, you're there, no problem. So you're feeling a little stress, a bit of stress about it, but you know you got somewhere to go. And then you're at level 4 where it's a stop. Like there is a accident on your way to work and it's a mile ahead and you know you're going to be in this for about 10 minutes and you know you probably going to be late. You'll be a couple minutes late because of this accident. And then you have your full stress. You're at level 5, you are in the accident. And when you get to that level, your sense of thinking things clearly are not going to be there. So we experience these 5 brain states throughout our entire life and daily. We can go through all of these emotions. And so where it gets critical are the stages of fight versus flight. And oftentimes, people of color who experience stress remain in the fight or flight mode, and they never get to experience levels 1 and 2. So the circuits are stored in the brain based on the stress level in which they were encoded. So of course, your base level was very low stress. There's nothing to worry about. You have also base level 2 is a little more pressure, but still it's low stress. And 3, we get into a moderate amount of stress. 4 is our high stress level. And 5 is that we are very stressed and we are not operating in our normal capacity of brain function. So each stress level is associated with a different brain area or brain state. Now here's where it gets technical, and I hope that you'll appreciate this, and this will give you some reflection as you reflect later in the day about this. So the model of the 3 brains is reptilian, limbic, and the neocortex. So our greatest state of being is the neocortex, and it's often referred to as the thinking brain. It's the most recently evolved and distinctly human region of our brain. It encompasses the cerebral cortex. It's responsible for a higher order of cognitive functions such as reasoning, language, decision making, and complex problem solving. This particular state enables humans to engage in abstract thinking, planning for the future, and executing sophisticated behaviors. It's a functioning, relaxed state. So between levels 1 and 2, we vary between the neocortex and the limbic brain. The limbic system, is comprised of structures of the amygdala, hippocampus, and hypothalamus, collectively known as the emotional brain. So this is evolving from brains of early mammals. The limbic system plays a central role in processing emotions. It forms memories and it regulates our psychological responses to stress. It intricately is involved in various aspects of social behaviors, of attachment, emotional processing, and shaping of our subjective experiences. Now we are fluctuating. Once we get into step 3, the limbic brain is responsible for a lot of our behaviors, such as eating, overeating, comfort foods, and also you're going to also get into addiction when you're at that state. And we have our reptilian and primal brain that is between 4 and 5. And this was actually identified by a person named McLean. And so this is their brain model, and it is the basal ganglia referred to as the reptilian or primal brain. It's a structure that is in control of our innate and automatic self-preserving behavior patterns that ensure our survival as a species. So this primal brain is in charge of the 4 F's, we call them: feeding, fighting, fleeing, and the other F word, which we'll just say reproduction. Um, Notably, this behavior pattern includes defense of self, family, and personal property, physical communication, and socially approved actions such as handshakes, head nods, and bowing. The reptilian brain is the highest stress level fight or flight, and many of us are operating in the reptilian brain and in the limbic brain, and we never get the opportunity to be in our neocortex very often. So our automatic responses and biochemically fueled drives vary based on the brain state. And so when you're interacting with people, you might want to just think about, I wonder what brain state they're in. And I think it will be very obvious for you to see at times what level people are operating on. When you're levels 3, 4, and 5, there is no shut-off valve, and you're not operating uh, as you should. And so this is why people can't quit, because the limbic stage of 3 and 4, if behavior produces pleasant emotions, we tend to repeat it or try to change our environment so that it occurs again. While if it produces pain, we remember that experience and avoid having the experience again. So thus, this component will have fundamental role in processing such classical conditioning or operant conditioning. And stages 4 and 5 of reptilian stage is feeding our fight, flight, flee, or reproduction defense mode. There is hope, and it is proven strategy known as a Spiral Up Light app. It helps you to feel better faster. Uh, its stress activates the fight or flight circuits in the emotional brain to drive addictive behaviors like smoking. And so EBT, electric brain training skills, switch off the fight or flight circuits so that it's easier for you to stop smoking. And this is a free app that's available to everyone. So how do you use it? It's very simple. It's proven to rewire trauma and addiction circuits. Spiral Up is to be used in moments of irrational panic, boredom, or when you simply feel bad for any reason. You do it 5 times a day, recommended, and it overrides your reflexive response to situational stress and anxiety. And even between uses, so you don't necessarily have to use it 5 times a day, it still is effective. The Spiral Up Light app rapidly switches off stressors at levels 3 and 4. So once you start to learn yourself and know what level of stress you're at, this application is perfect for you to use to bring you back to levels 1 and 2. So Spiral Up Light is one of our wonderful apps that you can utilize and you can share with the community. But I also like to share other resources with you regarding cessation. And Amplify has their own culturally tailored program known as Kick It Now. The information is available on our website, but we also wanted to make sure that we emphasize that cannabis smoke is still smoke, and we view it as such, and we also view it as an addiction. And here's a story from one of our participants.
Okay, my name is Joel Boyd, and this is my story. I had been smoking cannabinoids, for probably about 9 years. From age 20 to 29, I smoked all the time. I never smoked tobacco, but I know there can be side effects from the lighters that you use, inhaling the butane. I just kept noticing how much it was slowing me down. Smoking, whether it's tobacco, whether it's any vice, whether it's cannabis, whether it's drink, whatever it is, it's a way to cope. It's a way to deal with your problems or not deal with those problems. And so I heard of one of my best friends from college who I knew to smoke all the time. It's like, yeah, our friend so and so, she quit, and he's like, you know how she quit? I was like, I don't know. She was like, you know what she did? Every time she got the urge to smoke, she would go drink some water. It sounds so simple, like the metaphor of like a smoke cloud disappearing, but that's literally how it was. Like I just started drinking water. My finances increased, my emotional IQ, my mental health, my confidence increased. Even now, just last night, I did a show, I did an improv show, I did a comedy show. They offered me a hit, and I was just like, no, I'm good, man. Thanks. Especially coming out of being a people pleaser and just being able to say no. I think I'm a better version of myself because of it. I think I'm a better version for myself. I think I'm a better version of myself for my friends, for my family, for my fiance, um, because of this.
All right. So this program is available for people who smoke, to help family members. Resources for professionals are available, and we also have an online support group. And I did briefly want to touch upon the City of Berkeley's remote cessation classes starting in the fall. Please let your community know that this is available for them. And I'm going to end it here with hopes that you can stay on a bit longer because I went over my time, and then Tino has some great information to share with you.
Thank you so much, Yolanda. That was amazing. There was so much information. I'm learning stuff, and we're in this work, so that's how you know it's good when when your colleagues are picking up some new stuff as well. Um, Let me share my screen here, and I'll try to go quickly through these slides. Let's see here, so we can get folks out in a decent time. Um, There we go. So, you all know me. I already did my introductions, and but we're going to be talking about City of Berkeley's past, present, and future policy work, just to give folks in different jurisdictions some let them know what we're doing here and what may be able to work in your jurisdiction as well in terms of tobacco prevention policy and ways to help the community with dealing with the harms that come from these products. Um, so give you a little bit of background on our City of Berkeley Tobacco Prevention Program. We work with the Berkeley Tobacco Prevention Coalition. We work with schools and community partners to build capacity and respond to community needs to decrease secondhand smoke exposure, reduce youth access to tobacco, provide cessation resources, and prevent tobacco use. And our Berkeley Tobacco Prevention Coalition is a group of Berkeley community stakeholders who collaborate and partner with the City of Berkeley's Tobacco Prevention Program to advocate for tobacco prevention in Berkeley. And to have an impact on an issue, you must see it as an issue at first. And in terms of tobacco, over time, people have learned more about the harms of these products, and community advocates eventually worked with their local and state governments to create laws to protect the people. And in a moment, you'll see the Berkeley smoke-free policies from 2 decades ago to date. And keep in mind, laws aren't perfect, and sometimes a law may need to be revisited and strengthened to work better for the community in current times. So these laws help to protect the health and well-being of our community and environment. In 2002, before 2002, we didn't have tobacco retail licenses. So folks were able to sell tobacco without needing a license. In 2002, that was no longer the case, and we required tobacco retail licenses for Berkeley tobacco retailers. In 2014, smoke-free multi-unit housing ordinance was instilled, and that was protecting folks who lived in multi-unit housing, any apartment complexes, as long as it was 2 or more units. They needed to follow this smoke-free multi-unit housing ordinance, and that's to protect those from secondhand smoke and the harms of secondhand smoke from their neighbors. In 2015, Berkeley implemented tobacco-free pharmacies. And that made sense to many people, that your pharmacy probably shouldn't be selling a product that is harmful to your health. A pharmacy is supposed to have medicines and things that help folks. In 2017, flavored tobacco school buffer zones were put in, and that's a 600-foot buffer zone between a tobacco retail license holder and any school. And in 2020, flavored tobacco products are not sold in Berkeley, and that was put in before the state one, and that included menthol, and that also did not that banned menthol. It also banned hookah, which the current state law exempts. So we're just letting you know that this was a very comprehensive flavored tobacco prohibition law. And currently, the City of Berkeley's Tobacco Prevention Program is working on exploring the end of commercial tobacco sales in Berkeley and provide policy examples. We are exploring maintaining the number of Berkeley tobacco retail licenses to match up with health advocates' best practices. And we'll talk a little bit about that as we go on. We're also collecting, summarizing, and providing recommendations based on data which highlights client-patient referrals to smoking cessation resources in Berkeley. So the City of Berkeley's Tobacco Prevention Program conducted a public opinion poll of 161 Berkeley residents in December of 2022. Some questions and themes included reducing the number of tobacco retail licenses, exploring the end of commercial tobacco sales, and the impact of secondhand smoke. And based on the survey, majority of respondents have been exposed to secondhand smoke or vape from someone else's marijuana or tobacco products. Most respondents think drifting secondhand smoke from other people's tobacco is a problem in Berkeley. Half of respondents think smoking or vaping is a problem in Berkeley, and majority of respondents believe that their community has been negatively impacted by smoking and vaping or other tobacco use. When looking at tobacco retail licenses, we found that Berkeley currently has over 80 tobacco retailers. Given the city's population of roughly 119,000, this equals to one tobacco retailer per 1,500 residents. This is more than the recommended density ratio of one tobacco retailer per 2,500 residents. So there would be less tobacco retailers if we can follow that best practices recommendation. Um, over these Of these retailers, more than a quarter are located in the 94702 zip code. That's West Berkeley. Um, and Another quarter are in the 94704, and that's kind of downtown and UC Berkeley campus areas in Berkeley. The lowest average income area are 94704 and has the highest number of tobacco retailers. So that's something we noticed. Neighborhoods with the highest number of Black and Latinx populations, 94702 and 94710, have the highest number of tobacco retailers per population. When looking at the highest income area, 94708, it had the lowest number of Black and Latinx people and has no tobacco retailers. So we found this evidence, this data as we were going through and surveying and looking at the retailers in the area. Going back to our public opinion poll, majority of residents agreed fewer people would use tobacco products if it were harder to purchase them. Majority also support a law that limits the number of tobacco retailers in Berkeley. For example, a cap on the total number of tobacco retailers allowed in Berkeley, or a limit to the number of retailers in one neighborhood. And majority of respondents support a law that would eliminate the sale of all tobacco in Berkeley. And to be in compliance with the recommended density ratio of one tobacco retailer per 2,500 people, Berkeley needs to reduce the current tobacco retailers from over 80 to 50. Neighboring jurisdictions in San Francisco and Alameda counties have included density provisions in their TRL policies to reduce the overall numbers of tobacco retailers and to address the inequalities of distribution of tobacco retailers. When these provisions are added, they usually do not revoke any current licenses, only restrict new licenses. It is understood that the impact of the density provision will take many years to be fully seen. However, short-term results have been promising. For example, in San Francisco, we saw a 10% reduction in the overall number of tobacco retailers within 1 year of passing a density provision. Reductions were also greater in neighborhoods with disproportionately high numbers of tobacco retailers, which helped reduce inequalities. Majority of respondents would be more likely to vote for a policymaker that advocate for phasing out the sale of tobacco products in our community. Majority of respondents agreed fewer people would use tobacco products if it were harder to purchase them. And majority of respondents agreed that they are more likely to vote for a policymaker that advocates for phasing out the sale of tobacco products in our community. In April and May of 2022, retail observations were completed for 64 of the 86 currently licensed tobacco retailers in Berkeley as part of a statewide data collection effort. And data focusing on the sale of flavored tobacco products was focusing on flavored tobacco products, minimum pack size, and minimum pricing on tobacco products. The sale of flavored tobacco products in Berkeley currently bans the sale of all flavored tobacco products. Minimum pack size for cigarettes and little cigars and cigarillos is 20. Minimum pack size for premium cigars is 6. minimum price for cigarettes and little cigars or cigarillos is $8 per pack of 20. Minimum price for premium cigars is $5 each or $30 per pack of 6. And retailers are not allowed to offer discounts on tobacco products. And Berkeley currently bans the sale of all flavored tobacco products. 32% of stores selling tobacco were still selling menthol cigarettes. 35% of stores selling tobacco were still selling flavored non-cigarette products. And 15% of stores selling tobacco had flavored tobacco products ads either inside or outside the store. 36% of stores selling little cigars or cigarillos sold them in packs of less than 5, which is out of compliance. And 56% sold them in packs of less than 20. Non-compliance rates was between 36% and 56%. 44% of stores selling little cigars or cigarillos were selling them at a price less than 5 per pack. 20% of stores selling tobacco were selling a pack of 20 cigarettes for less than $8. Those are out of compliance as well. 63% of participants are not smoking. So this is with our tobacco treatment classes. This is a class that I facilitate. I've been facilitating for over 6 years, and it's definitely a labor of love for me. I lost my stepfather to smoking tobacco. He developed lung cancer and passed away because of that. And it wasn't a nice ending. It was very traumatic, and it stuck with me. And which is why I have such a passion for this work. This class is an 8-week virtual class to help people on their quit journey to quitting smoking for good. And using tobacco products or using tobacco products for good. 63.7 or 76 over 63% of participants are not smoking on the last class of the series. And this is when we averaged since from 2019 to 2024. That's where these numbers come from. 73.9%, 99% of participants have not used any form of tobacco products for 1 day, 24 hours, or longer during the clinic or series. These are huge steps in the right direction. And 100% of participants would recommend the clinic or series to a friend who wants to quit. So we are very proud of that, these numbers and the experience folks are having in our program. Among adults who smoke cigarettes in the past 30 days, over 30% reported that they plan to quit smoking in the next 6 months, and over 40% made a quit attempt in the last year. Among adults who used vapes in the past 30 days, over 42% reported they plan to quit vaping in the next 6 months, and almost 40% made a quit attempt in the past year. So the City of Berkeley's tobacco prevention program is partnering with at least 3 healthcare and/or community health organizations, and they will adopt and implement policies for comprehensive screening, assessment, education, and counseling, or referral to evidence-based cessation programs such as Kick It California, Kick It Now, Spiral Up. So just trying to make sure that they are getting in contact with resources and tapping into these resources, hopefully soon after their visit or even during their visit. And here's our contact information. We also have a survey. Thank you so much for hanging in there. I know we went a little over, but I appreciate y'all for hanging in there. And I'll share our survey in the chat. It helps us to improve these presentations, and it takes less than 5 minutes. You can be entered into a gift card raffle for completing it, and I'll post it up in the chat shortly. Thank you again.